Hi, good evening. Welcome everybody for this fantastic Vattikuti Foundation Masterclass on hyperthermic intraperitoneal chemo and role of pressurized intraperitoneal chemo PIPAC in ovarian cancer. I'll just give a very short introduction, the scenario in India, so we can hear from the expert how we can modify it. We know that there is a group of distinct group called as peritoneal surface malignancy, where by far the disease is confined into the peritoneal cavity. Rarely extra abdominal disease is cause of death, but the death usually is cancer cachexia, ascites, peritoneal recurrences, obstruction, not able to maintain nutrition, and the complication. So this is where we have a group where ovarian cancer sits into this. So it makes logic to have a loco-regional treatment in addition to a cytorectal surgery for peritoneal surface malignancy. The whole concept is predominantly this is the site of the disease. And if you can have a good abdominal cavity control, we can achieve excellent overall survival and quality of life. Unfortunately, worldwide epithelial cancer come in advanced stage 3 and 4C. If you look at 5-year survival in advanced ovarian cancer, when you do a best surgery, it is dismal 10 to 20%. That shows there is a big lacunae in the field of this. And this is all the part of the surgery which needs to be done in ovarian cancer by virtue of its spread. The abdomen may look like this, and you can have a tons and tons of disease in epithelial ovarian cancer like this. But it is very rewarding to do a good cytoreductive surgery, the same abdomen with good cytoreductive techniques. After 7 hours, will look like this, no peritoneum, no Gleason capsule, everything in the abdomen, upper abdomen is stripped, and optimal cytoreduction, CC0 is achieved. And when you have such thing, still you have microscopic disease and 2/3 of them recur. That is where the concept of macroscopic clearance by good cytoreductive surgery and the role of intraperitoneal chemo with or without hyperthermia comes. And if you look back, we have an Indian HIPEC registry for ISPSM, where 2016 epithelial ovarian cancer under 26 centers in India with a follow-up of 6 median years, we could find that the 30-day mortality in Indian group over 2000 HIPEC for ovarian cancer is 3.6%. And this particular group, when we compared surgery alone with HIPEC, survival curve is significantly in favor of HIPEC in Indian group, where 40% 4-year survival was there when we do a HIPEC, contrary to 25% only if you do a surgery and IV chemo. And in Indian HIPEC registry, we found upfront cytoreduction and HIPEC was better than interval cytoreduction and HIPEC. And when we compared cytoreductive surgery with IV chemo versus port-based intraperitoneal chemo and HIPEC, we found the HIPEC group fared very well. And any form of intraperitoneal therapy, either 6 port-based or HIPEC, had the best 5-year survival. In Indian HIPEC registry, this was the group which we had. And among the PIPAC front, we are running 2 randomized control trial, which is registered with the IRB approval and trial registration CTRI. And this is for platinum resistant second line IV chemo versus PIPAC. And I'm going to present the interim analysis of more than 70 to 80 patients recruited in Rome ISSP meet, where we found 70% response rate, and the median survival was more than 12 by PIPAC group. And then when we looked at EORTC global quality of life, the score was in favor of PIPAC than the IV, with side effect being negligible when we compare to IV. This has been all published in Plura Peritoneum. So this is the introduction, and this is where India stays. So what more best to have the best leaders in the world headed by the Netherlands unit. And I thank Henk for this, and our close friend, Professor Bakrin from Lyon, France, to take it forward.